Hey guys, Dr. Anderson here. I'm talking to you today about nerve pain, and this patient's name is Michaela. This is something I see a lot, and frankly, almost too much. It upsets me when people come in like this, because Michaela's been suffering for 5 years with nerve pain. And she had an injury, and I'll have to explain the injury in a minute, but she went through 4 or 5 months of physical therapy, trusting the doctor that sent her there, probably trusting physical therapy, trusting that, well, I guess that's all that could be done, pretty much, right? Yep. And so let's start with that. So why don't you just share with everybody your story, but I want you to be alerted. If you've had an ankle injury, you've had surgery on a foot or ankle, or a really bad sprain and the pain doesn't seem to go away, this is a video for you. And I want Michaela to share what happened, starting with the golf cart.
Yes, about 5 years ago, I rolled a golf cart and my leg and ankle got stuck under the golf cart and dragged. And my leg and my ankle actually got stuck within the wheel well. That I had road rash, I pulled my ankle, they put it in a boot, and then I did about 4 months of physical therapy that summer, trying to get my foot back to normal. It never went back to normal. They kind of just explained that was my new normal.
Right, and you're on Lyrica.
Yeah, I'm on Lyrica, so it went from being completely numb to now being in a lot of pain with the help that the Lyrica did.
Right. Okay, and so when she came in, it was apparent to me that she had nerve damage going on here, and so in a way, no amount of immobilization would help with that, really. And maybe they suspected back then that you twisted your ankle, so that's fair. They probably knew that's what happened, and they had to be immobilized. But once you come out of immobilization, guys and gals, and you still have pain, that's when you really need to think about finding a peripheral nerve surgeon like myself. So she came in, and I could tell that she had stressed these nerves here. There's a nerve up here. It's called, come in a little closer. The main nerve that supplies the top of the whole foot is called the common peroneal nerve, and it has a tunnel here. Then it divides and sends a branch down this way. Then this is called the deep peroneal nerve tunnel, and then another branch comes along here. It's called the superficial peroneal nerve tunnel. The superficial peroneal nerve tunnel, and the nerve supplies this area. The superficial peroneal nerve oftentimes gets pulled or stretched. When you twist your ankle like this, the forces that are generated when you break an ankle, when you have an ankle sprain, can really yank and tug on that nerve. And so when I examined her, I could sense that she has a little bit of a drop foot. She wasn't able to pull her toes up very much. That told me her common peroneal nerve is damaged. Also, just all the burning and tingling that she had here. What we did diagnostically, and I'm going to pull your attention to this. This is an ultrasound machine, and this is a nerve. That little white area is where we injected some local anesthetic, and this is a new technique that we've used. It's called the Phoenix phenomena, but don't ask me why. But anyway, the guy that invented it called it that. But this is called the common peroneal nerve. Again, that's the main nerve that goes and supplies everything on the top of the foot. It's up here by her knee joint. And that darkish area is where I put some local anesthetic. I just put a very small quantity of local anesthetic right beneath the skin, but right above the nerve. And tell everybody what happened after that.
After that, it was like a wash of relief over my foot. I can feel my toes and move them up and down. I hadn't done that in probably 5 years.
Excellent. So you feel more strength.
Oh, definitely.
A lot more strength.
Yeah.
And
80% better. I can move it back and forth, side to side. Before that was not really possible without a lot of pain.
No, that's not going to last, folks. That local anesthetic is called lidocaine, and it's only going to last maybe 3 hours, 4 hours. Then her symptoms will come back, unfortunately. Yeah. But what it provides her is good indication that if we surgically were to open up that nerve tunnel, it should work. Yes. And that nerve tunnel is part of the problem. There's a couple other ones too that we could talk about, but that's all I'm going to talk about for now, is how this injection, it's really a lot of fun for me and the patient when we do this, because they get instantaneous relief. And it's something new that very few doctors know about or know what to do, let alone evaluating in this manner. So understand, if you're having issues and you've had treatment in the traditional manner for an ankle injury or maybe an ankle fracture and you're still in pain, please consider looking into seeing a doctor that's trained in peripheral nerve conditions like myself. And you don't need to suffer with this. So anyway, I hope that was educational. Thank you for listening, and I don't know if there's anything you want to say.
No,
that's pretty
great
cool.
So far.
Okay. Thanks a lot for taking the time.